Good day, my name is Princess Julia E. Dela, a student from Nueva Ecija University of Science and Technology, and today I will show to you on how to perform urinary catheter for female. Assess the need of catheterization and the type of catheterization ordered to assure the proper procedure and is carried out. Assess for the need for peritoneal care prior to catheterization to reduce the transmission of microorganisms. Assess the urinary meatus for signs of infection and inflammation. Assess the client's ability to assist the procedure. Assess the light. Assess for an allergy to provide iodine and or latex to avoid an allergic reaction. Watch for indications of distress or embarrassment, especially if the nurse is opposite gender. Determine what teaching and support are needed. Explore further if indicated. Gather the equipment needed. It promotes efficiency in the procedure. Close the curtains of the bed to provide privacy. Provide client's privacy. Provide for privacy and explain procedure to client. It promotes cooperation and client dignity. Good day, my name is Princess Julia E. Dela, a student from Nueva Ecija University of Science and Technology. May I know what is your name? And what should I address you? Okay, so Berlian, today we will do Foley catheter in your urethra. Is that okay with you? Assist the client to a supine position with legs spread and feet together or to a side-lying position with upper leg flexed. It relaxes muscles and allows visualization of the area to facilitate insertion of the catheter. Drape the client's abdomen and thighs if needed. It promotes client comfort and warmth. Ensure adequate lighting of the penis or vagina and perineal area. It facilitates proper execution of technique. Wash hands, apply gloves, and wash perineal area. It reduces the transfer of microorganisms. gloves and wash hands. It reduces transfer of microorganisms. If the catheter is not included in the kit, drop the sterile catheter on the field using aseptic technique. Add any other items needed. It prevents contamination of the sterile equipment in the sterile field. Apply sterile gloves. This may be included in the kit. It prevents contamination of the sterile equipment in the sterile field. Attach the catheter to the urine drainage bag if it is not pre-connected. The catheter and drainage system may be pre-connected. Otherwise, connect it before catheterization to avoid exposing the client to ascending infection from an open-ended catheter. Generously coat the distal portion of the catheter with the water-soluble, sterile lubricant and place it nearby on the sterile field. It facilitates catheter insertion. Place the fenestrated drape from the catheterization kit over the client's perineal area with the labia visible through the opening. It provides a sterile field at the procedural site, prevents accidental contamination from the adjacent areas. Gently spread the labia minora with the fingers of your non-dominant hand and visualize the urinary meatus. It helps locate the meatus so the catheter can be placed in the correct spot. Holding the labia apart with your non-dominant hand, use the forceps to pick up a cotton ball soaked in povidone iodine and cleanse the periurethral mucosa. Use one downward stroke for each cotton ball and dispose. Keep the labia separated with your non-dominant hand until you insert the catheter. It cleans the area and minimizes the risk of urinary tract infection by removing surface pathogens. Holding the catheter in the dominant hand, steadily insert the catheter into the meatus until urine is noted in the drainage bag or tubing. It provides a visual confirmation that the catheter tip is in the bladder. If the catheter will be indwelling with the retention balloon, continue inserting another 1 to 3 inches. It ensures adequate catheter insertion before retention balloon is inflated. Reattach the water-filled syringe to the inflation port. It provides a sterile method of inflating the retention balloon. Inflate the retention balloon using manufacturer's recommendations or according to the physician's or qualified practitioner's orders. It ensures retention of the balloon. Retention catheters are available with a variety of balloon sizes. Use a catheter with the appropriate size balloon. Instruct the client to immediately report discomfort or pressure during balloon inflation. Pain or pressure indicates inflation of the balloon in the urethra.
Do you feel any pain?
Once the balloon has been inflated, gently pull the catheter until the retention balloon is resting snug against the bladder neck. It maximizes continuous bladder drainage and prevents urine leakage around the catheter. Tape the catheter to the abdomen or tie snugly, yet with enough slack so it will not pull on the bladder. It prevents excessive traction from the balloon rubbing against the bladder neck, inadvertent catheter removal, or urethral erosion. Place the drainage bag below the level of the bladder. Do not let it rest on the floor. Make sure the tubing lies over, not under, the leg. It maximizes continuous drainage urine from the bladder. Drainage is prevented when the drainage bag is placed above the abdomen. Remove gloves, dispose of equipment, and wash hands.